Good evening, everybody. My name is Kathy Molig. She, her are my pronouns. I am the Executive Director and founder of Trans Family Support Services, and we're so happy to have you joining us this evening as we have a conversation about COVID and the vaccine and the trans and LGBTQ community. So before we get rolling with our panelists, I just wanted to share this message from County Supervisor Nathan Fletcher.
Hi, I'm Nathan Fletcher, Chair of the San Diego County Board of Supervisors, and my pronouns are he, him, his. I'm here to urge you to help others by getting your COVID-19 vaccination if you haven't already done so. I want to convey my thanks to the Trans Family Support Services and Equality California for their intentional and focused efforts. Their important partnership is helping bring together our community by amplifying the message of staying healthy together by getting vaccinated together. Hi, I'm Nathan Fletcher.
We are so grateful to Supervisor Fletcher, who is a staunch supporter of the LGBTQ community here in San Diego and has done an amazing job leading our county through the pandemic over the last 15 months. So I am joined this evening by Jesse Greenfield, who is with San Diego County. They are a community health worker support specialist and working specifically within COVID, and Dr. Jill Blumenthal, who is an associate professor of medicine and an infectious disease physician with UCSD. So welcome to both of you.
Hello.
So, hi. So let's maybe get started a little bit with Dr. Jill, if you want to kind of give us a little bit of an update of what's happening within our county with COVID rates at this time.
Well, hi everyone. I'm glad people are joining for this really important talk. And I'm also really glad that Jesse is on here, because I think that Jesse is going to be able to give some really great updates on, really on the county level. But fortunately, we are in a county where we are seeing continued declines in our daily case rates, in our hospitalizations, really probably in one of the best situations we've been in quite a while. And I don't want to give specific numbers. I may give that to Jessie since she has all those statistics. But I think that is in no small part to our really high vaccination rates, even though we still are not quite there. And I know we're going to talk about that a little bit more later. But we're actually in a I think a pretty good state right now. And I get our hospital sends updates on our hospitalizations, and we've had less than 10 hospitalized at UCSD for many weeks, if not months at this point. And that's fabulous. That's, at sort of the worst time we had over 160 patients. So to give you a sense of where we are with that, we're in a much better position. So this is all the good news.
Okay. And Jesse, what do you want to add to that about numbers?
Well, I can come from more of a vaccination perspective. I think it's super helpful that Dr. Jill is talking about COVID cases and rates of infection. And most of the numbers that I work with every day are about how many people are getting vaccinated. And in San Diego County, like you both have mentioned, there's been a lot of push to get people vaccinated, and it's working. It's working. As of now, everyone 12 and older is eligible to get a vaccine. And of those eligible, the county of San Diego has 88.7% of the eligible people fully vaccinated, that's amazing. But that means there's still some work to do, and still more people to reach. So on the vaccine front, the numbers are looking promising, but of course there are certain pockets, certain groups of people, certain areas that are definitely like needing access, or there needs to be more effort going directly towards those groups of people. And I definitely think the trans and non-binary community, speaking from my own personal experience, I'm happy that this is happening and that more specific focused outreach is happening for us.
So I know that information is being collected by the county around COVID infection rates that include sexual orientation and gender identity. But are we collecting any of that information when it comes to vaccines?
No, it's very frustrating. It's very frustrating. Currently, well, so if you look at the vaccine dashboard, should I pull it up?
Sure.
It's a little hard to read, but hopefully it's okay. Okay.
I think this is important because anyone can access this, right? And this is sort of a fun thing to toggle through if you have some time and want to look at the numbers.
Totally. Yeah, it's like a bit of a mess because what you can do is you can zoom in and click on different things. So like I said, look at all these people that we have fully vaccinated. But I'm going to scroll down to gender. Bummer, right? We got male, we got female, we got gender unknown. And I'd say I'm none of those things, so that's a little confusing to me about that data. So that's I think a lot of things that personally, like people that I've spoken with, my friends, my peers, feel a little bit hesitant or a little bit unsure because they're not really collecting data on us. Like how do we know how this is working? But I definitely think that the science, which Dr. Jill can obviously speak much more to, says that this is still really, really important, even though data at this level is not really being collected.
So let's talk about the science for a minute, Dr. Jill. Let's talk about the safety. I mean, we see these really incredible numbers in San Diego County, and I just shout out to everyone in the county that has been part of that over 80% vaccinated. As a person who was in pretty much complete lockdown because of my son's health conditions, the entire 14 months, I'm super excited that outside things are great for me now because I feel safer that we're vaccinated and over 80% of the community is vaccinated. But let's talk about the safety of this vaccine because we know there is still a lot of hesitancy. And what can we do to help bring more information to people?
So I feel like there are a lot of aspects to that question, just starting with the safety itself. I mean, we now know that this vaccine has been given to, actually, I don't even know worldwide what we're talking about. We've maybe have reached 1 billion. I mean, there are millions and millions of people that are getting this vaccine. And there is, the nice reporting system that we have, the VAERS, which, everyone is encouraged once they get it to sign up for it and report anything that's going on. And the reason that we ask people to do that is so that we really do understand all of the side effects that are going on with this. So we have, the side effects related to what was seen in the vaccine trials. And the side effects, if you look at some of that data, there were a lot of side effects, but they are fairly minimal things, fever for a day. The most commonly reported thing is an injection site reaction. You are probably going to have an injection site reaction, but these are all things that are sort of common with vaccines themselves, and people get vaccines all the time for various reasons. I know there are vaccine hesitant people for lots of different things, but basically when we think about the safety of a vaccine, we're thinking about the things that can happen when we get just sort of a typical vaccine. I think some of the things that became a little bit more concerning are the things that might happen sort of further down the line that could be a little bit more dramatic. And I think the couple of things that came up that was in the news a few months ago were the blood clots that were seen in some of the patients who had received the Janssen vaccine. They've now looked at this across lots of different patients that have gotten it. And we're talking about a rate of 1 in 110,000 people. So we're talking about very small amounts. And it was really, it was in cisgender women of childbearing age. So it was really a very specific population. I think it gave us a little bit of pause for concern. The news had come out 2 weeks after we had done a vaccine clinic with San Diego Pride focused completely on the trans and non-binary community. And I had a little bit of a panic attack. I was like, oh gosh. And, a lot of patients are on hormones. There was some suggestion maybe it was connected. It basically hasn't really borne out. And this is why we never want people to panic. We want them to report things when they have so that we can get more information. But basically, after looking at that more, that really, there's a slight increased risk, but I told you the number 1 in 110,000. And then, of course, I compare that to, sort of what's the chance that you get COVID and what could happen to you when you get COVID. And those are things we can talk about maybe a little bit more on the medical side of things, sort of all the risks that we know that can be associated with the actual infection, and then spreading it to other people who potentially, even if you may not experience anything, someone else who could, experience something. The other thing that's been in the news a little bit more recently is this effect or this complication in young people of something that we call myocarditis. And it's basically essentially some chest pain related, or the heart basically gets inflamed. And what we've learned from this is it seems to self-resolve without too much happening, and hasn't caused, it's obviously very early, but we don't think anything long-term sequelae, as opposed to for COVID, where we know that there could be long-term sequelae, even in patients with mild symptoms or potentially asymptomatic disease.
And I think that's a really important point. As a parent, my children are adults, so kind of out of that more at-risk sort of category. But as a parent, like that concern of, but wait a minute, if we do this, there is this risk, and we forget. But if we don't do it, there is this risk, right? And I think about when the HPV vaccine first came out. And there was so much conflicting information when that first was introduced that as a parent, I paused for a couple of years because I felt like there was conflicting information, right? This doesn't feel like it's conflicting, though. It's pretty straightforward. There's a chance. Go ahead.
That's how I feel. I'm also like a hyper preventionist. So unlike you who paused on the HPV vaccine, I was like, who gets it? When can I get it to them as quickly as possible? I think vaccines are incredible and really have changed the scope of the way infectious diseases look. And I have firsthand seen what COVID has done to patients and, to families. This to me clearly is a no-brainer in that way. And maybe we can talk about why some hesitancy remains. And I think sort of, where those pockets are, there may be some reasons for why there is some hesitancy. And I also want to be clear, I have patients that are still not wanting to receive the vaccine. So it's not like I've been able to convince everyone that I care for that they need to do this. We know that that's still going on. And, and how do we approach those people? I think the best thing we can do is give them the best information that we have.
Yeah.
I'd also love to add really quickly. Sorry, I'd also love to add that I think it feels extra important for the LGBTQ plus community to get vaccinated because of, we're more likely to have asthma or be smokers or have things that specifically could complicate COVID-19. And I think I haven't heard that talked about a lot, but I think it's really important to mention how it's really if it's a trade-off between side effects for a day or getting COVID-19, I think it's something that not a lot of people are weighing. Okay,
Yeah.
someone asked more about
Jesse, really quickly, just to add to that.
Yes.
And I agree, not that I want to make, I think Kathy knows that one of, and I think her big push is to make care, more equitable and accessible and all of that. But I know not a lot of people like to go to the doctor. I'm going to say that in general, and I know that to be more specific sometimes to transgender individuals. Well, if you get your COVID vaccine, then there's less chance you're going to have to go to the doctor and end up in the hospital, which is really not a fun place to be. So I always think about that as well.
Yeah.
Just, you don't like going to the doctor? Well, let's get this taken care of. One less thing you have to worry about.
Yeah. That's a true
It's
point.
maybe
Like
it's not the best point,
but it's that whole piece of prevention that really does pay off in the end. So Jesse, can you help us in answering that question? Where are the pockets located in San Diego for folks that are not vaccinated?
Yes, absolutely. I'm going to share my screen to the little dashboard again really quickly. This is just a geographic thing. I just pulled up the bottom here. This shows you, this is not that helpful because it's not an actual map, but it's the regions of San Diego County. So if we're talking east region of San Diego, I'll show you my face again. If we're talking it's like the east region of San Diego. So yeah, there are multiple cities that includes, but kind of more inland, and also places up north. And there's definitely also some age disparities. It's less focused in geographic regions because at this point there are vaccination sites all over the county. Like you can get vaccinated anywhere, and I'll show you how to find that information and show you where to find a site later. But it's not that there are no sites in East County. It's maybe in East County things are also more spread out. It's more rural. Maybe it's harder for people to access sites, or less centralized information. Generally, the places where people are less, or the vaccination rates are lower, are where we're seeing historically where people have not been as connected to resources. So definitely lower income communities, specifically Latinx communities. But there's been really, really intense outreach, which has been working. And slowly those numbers are creeping up. And I think at this point, the people who have not been vaccinated yet, and they want to, or they're trying to, but they haven't been vaccinated yet, that tends to be people who live in more rural settings, and also people who are hesitant about going to the doctor for various reasons. They have historically not awesome relationships with the healthcare system, or they're not sure how to go, or they don't feel like they can take time off work. Maybe they don't see that there are sites near them that they can go to when they're not working. But it's also, it's mostly in the east region, and also with younger folks. Oh yes, that's what I definitely wanted to mention.
The age.
Yeah, so 12 to 17-year-olds are the newest population who are eligible. And so I think from what I've heard, at least there are people who are kind of wanting to wait and see, or because they are, they're more recently eligible, it's taking a bit longer. So that's definitely something that I know the county is focusing a lot of efforts on. And yeah, definitely something that we're working on.
All right.
I think also to be clear about the vaccines, what people can get, that for 12 to 17, currently only Pfizer has the emergency use authorization, although Moderna, Novavax, and I think Janssen all have studies, with younger people. So, there will be more coming, but right now, at least, Pfizer is the only one that you can get for 12 to 17-year-olds.
And also at every county site, even if they're this site gives Moderna, basically almost all of them will have Pfizer on hand, so that if someone who is 12 to 17 years old comes to get vaccinated, they're able to do that. And I can also walk through, if you're making an appointment, what it is like if you're 12 to 17, like how to do that, because there are a few more steps, a consent form or two in the
so
works.
why don't you go ahead and go through your thing, and while you're pulling that up, one of the pre-questions that we got is, can I choose which vaccine, right? There's some new information going around with longitudinal studies around the Pfizer and Moderna versus the J&J. So can people say, no, this is the one that I want now?
I don't know if you're better equipped to answer that or me. I mean, I can certainly say that at the UCSD sites, you do get to select which vaccine you want. That's generally the way it is now, that there is so much availability. That was not the case at the beginning. I will tell you, I was one of the site investigators for the Moderna vaccine. I wanted a Moderna vaccine, and all that was available was Pfizer. I took Pfizer because that's great too. The bottom line is, all of the vaccines that are approved work, and we know that they're effective. I definitely think a few of us have some opinions about what, I mean, I think a lot of people have seen the efficacy studies, and they look better if you just put them side by side. It looks better for Moderna and Pfizer versus Janssen, but you have to remember that Janssen was done, the main parts of the study were being done where there were huge surges in cases and variants were starting to happen. And I know Kathy wants us to talk about variants later. We'll come back to that. But with, there was definitely, it was a different context, different countries. For Janssen. So it's you can't really do it completely that way. I think, I generally tell people, if they think they can handle doing 2 vaccines, my preference from sort of what this might look like long-term in some of those studies, that would be my preference. If you're someone who just wants to get 1 shot and that's it, then, the Janssen one is for you. But the bottom line is, if you do show up and they say, you're sort of counting on Moderna, but they only have Pfizer. To me, those 2 things are fairly equivalent. The Janssen's a little bit different. And if you really feel like you want the messenger RNA vaccine, the Pfizer or Moderna, I'd stick to your guns on that one. I think some people want that 1 shot for a particular reason. And I think it's a great reason for a lot of people.
Yeah. All right, Jessie, take it away for how do I go about getting a vaccine?
Yeah, absolutely. Here, I'll start from the beginning, but I do want to note, you'll see this, that I have a few different. Okay. So I do want to note that when you're making a vaccine appointment, you can see like which vaccine is offered at the site that you're going to. So I'm going to reshare because I wanted to show you something different. Okay. So I'm just going to share this whole window. Hopefully this is working. Oh gosh. Okay. So, whoa, sorry, too many tabs. So we will share this link with you so that you can kind of follow along with where I'm going. This is the San Diego, if you just Google San Diego County vaccine, you will come to this vaccination page. So it's san-diego-county.gov vaccines. And actually this page, I'll talk about this really fast, is a super, I don't know, full wealth of information. There's all sorts of, information pages. So if you're like, I'm still not sold, got some more questions, there are clear answers to a lot of the frequently asked questions, like how are the vaccines developed so quickly? All that good stuff. And so here, this button is find a COVID vaccine site. And you can either pick, if you want to get vaccinated tomorrow, you can pick by day, but also I think it's just easier to find a map, to find a location. And then Okay, so it'll pull up a map, and most of these, there are a lot of sites that you do not have to make an appointment at all. So I'll just click on some random site, and usually, sorry, this is taking a very long time, but I'll keep talking. Essentially, what this will do is it'll tell you, oh, great, okay, so this is at the Poway Business Park. Appointments are available but not required. Oh, great, I can go tomorrow. So I'll schedule an appointment. And this will take you, most of them will just take you to My Turn, which is how California is booking all of its vaccines. So you can schedule an appointment. We can walk through that in a sec. You can also learn more information. There's actually like a lottery system going on. You can get lots of cool prizes for getting vaccinated. So that's pretty fun. Kind of bummed that I didn't win the $50,000, but maybe next time. And so you can either find a walk-in clinic or you can book an appointment. So I personally think, for the most part, I've been hearing that walk-in clinics, I'll just put in a random San Diego zip code. Yeah, a lot of walk-in clinics now, because many people have been vaccinated and we have a lot more vaccines available, you hopefully / probably won't be waiting that long. Okay, great. So I see that Sharp Chula Vista has Moderna. And both doses. So let's say I've already gotten my first dose. I can go and know that, okay, I got Moderna for my first dose. Boom, I'm going to go back there, get Moderna again. But see, they specify 18 plus, because if it's Moderna, like, oh, see this one, Sharp Chula Vista, has options for Pfizer. So that's people ages 12 plus. So this is just the information, right? I didn't make an appointment. And maybe I can talk really quickly. So if you do want to make an appointment, or okay, let's just say you're 14 years old. You're in that 12 to 17 age range. So there are a few different things that would be helpful. So if you are able to go to a vaccination site by yourself. That is allowed. But here, let's see. I'm going to pull up the info.
So while you're pulling it up, when you say that a 12 to 17-year-old can go on their own, does that mean they can be vaccinated without parental consent?
No.
Okay. I just want to specify that.
Yes. Yeah. That's what I was going to pull up there are a few things that'll be helpful, helpful to know. So I'm pulling it up now, and it's the things that you need. I'll post a link in the chat as well so that people can look through it. But if you are 14, and you can go with a parent or legal guardian, and they can provide consent while you're there. You don't need to fill out any forms or bring anything. They can be like, yes, this is my child, this is how old they are, vaccine them. And then but also you can have another caregiver, so maybe like a relative. They can also bring you, but they need to sign like a special affidavit. But they are allowed to bring you, and in that case they can also vouch for your identity. But it would be really helpful if you had like a school ID card or anything that would possibly ID you. I know that a lot of young people don't have that, so helpful. And if you're going on your own, almost any vaccination site will have these forms on hand if you're going like with an adult. But if you're going by yourself, you need to like put on your backpack that has your caregiver consent form in it. And it'll be in the link that I'll send you, so you can see where the consent form is, so you can fill it out. And you need like an identification. And I know that's been like I I know that's been tricky sometimes in different states. This hasn't happened in California, but I've been hearing a lot about it. Like, people have told me that they're concerned about it, is that they're like, I need to bring multiple forms of ID, like, but my name on my birth certificate is most definitely not the name that's on my ID. But in San Diego, they ask all sorts of strange, like, information that feels unnecessary to give someone a vaccine. But in San Diego, that is not a thing. You only need one singular ID. That's mostly just to, like, prove, I don't know, to prove your age is one thing, and just to be like, yes, I'm a person, or like, I haven't gotten one already, kind of thing. So they shouldn't ask you any additional questions. There's no confusion about names or gender identities or anything like that.
Okay. So if a transgender person shows up and says, my name is this, but they show an ID with a different name, nobody's going to question them. That's what you're telling me at the county sites.
Oh, that a different name that's on their ID that they do bring. Okay, so, well, I guess maybe I can specify that you can bring, there are multiple types of ID that you can bring. So ideally, like, your ID would match your name that you have currently, but it doesn't need to be your driver's license. Like, there are, if you have a work ID or, you know, anything that is like a current identification, and at a county site as well. I'm pretty sure. I can definitely double check and get back to whoever wants this information about this. Like, that I can double check, but I'm pretty sure that should not be a problem. And also, there are several sites that are not like county specific sites, but places that where I can't exactly link to them, because they're usually just like events happening all the time by different community-based organizations. Unfortunately, there's no like centralized website or like hub where all of those are advertised. But a lot of them, UCSD also they've been having some that are specifically for trans and non-binary people. And I had friends that went and they were like, nobody even misgendered me a little bit. So that's awesome. Go ahead.
That was a great.
Oh, go ahead, Kathy.
I was just going to say that was a great service to the community that UCSD partnered with San Diego Pride to offer those vaccines twice now. And I know lots of folks that took advantage of that because they have that hesitancy to show up in any kind of a medical setting, right? I mean, a doctor's is one thing, but even going to a vaccine clinic is medical setting. So having that medical setting come to a safe place like San Diego Pride was awesome and genius, and loved that.
No, it worked out really well. And I think basically, I think a person can say, this is, the name that I use, but whatever is, on their legal paperwork, that's what they're going to need to show. So if that, they can certainly, I don't think they'll have an issue saying, here's my name, but here's what's on the legal documentation. That's what they just need to see. But I think if there's a mismatch if the preferred or the chosen name is different, I don't think someone's going to be turned away. They do want to see some sort of identification. But yeah, I wish I had more specific to that. I was actually just about to say, and here's what's going on at UCSD. And when I went to our website, we're actually not even offering vaccines we had two big vaccine clinics. One was in Petco. I'm sure a lot of people were aware of that. It was the vaccine superstation, and that went away when the Padres started playing. And then we had one in La Jolla on campus at the REMAC Center. And then they opened one up in Hillcrest. Well, it has become so available, in sites outside of it. They're no longer doing it. I think this may have just happened this week. I just went to look to be like, and here's the UCSD information. And it all points to the information that Jesse's using with My Turn and Vaccine Finder. And that may be happening at more and more hospitals. So if you're attached to a hospital system, they may be saying, because there is so much availability. And to your point, people don't like to go to the doctor, but they do sometimes have to go to the pharmacy potentially to
Yes.
get medications. And maybe they have a pharmacist they like. They're sort of used to that. I hope that would be another place that they absolutely should be able to get their vaccine unless something has changed dramatically with that. I was surprised to just learn that UCSD is not doing them right now. So, yeah.
I'm glad you brought up the pharmacies, because sometimes that access is there that makes it a little bit easier for folks. And that trust piece, like you said, if it's someone that, you're accessing the pharmacy very often, then you're going to feel like, hey, this is a person I know and trust and can ask questions and that sort of thing. I want to put a small thing, and then we're going to come back around to you, Dr. Jill, on some of the science stuff. That, needle phobia, which is huge in across communities, right? I happen to be one of the people that suffers greatly from needle phobia. And I forced myself to watch the news and watch people be injected for months on end as kind of like an exposure therapy sort of thing. And it honestly, I didn't think it would help. Somebody had suggested it to me. I'm like, oh my gosh, this is worse, because I normally watch like that. But it actually did help. And I was pulling for the J&J, so I only had to do it once, and that didn't work. So I took the Pfizer and I did it twice. And, it really wasn't, it was not catastrophic, let's put it that way. Like needle exposure has been for me sometime in the past. So let's get into the sciencey stuff, right? So let's talk about the Delta variant, because that's a huge piece on a lot of people's minds.
For sure. So I did want to just update myself on where we are, and as of a day ago, it's still not the biggest, it's not the most commonly found in California. It's the third most common strain found. So we're not there, but I have a feeling it may end up becoming the predominant strain, going from, it was about 5% of identified cases back in April, and now we're about 20%. So we still are learning, and we don't have as much information as we'd like, but it is definitely the variant to watch. I think some good news that came out over the last few days is that it does seem like both Moderna and Pfizer are about 80% effective against the Delta variant. And I do want to remind people what we know about the Delta variant is that it seems to be more infectious, and that it seems to be able to spread from person to person more easily, but we still don't know, and we still haven't seen an explosion in our hospitalization rates or any changes from that standpoint. So it doesn't seem to cause more serious infection, and I think that's a really important point, and why I don't want people to get too alarmed by this. But it does seem to be pretty contagious, I'll say, or easily transmissible. But again, if you have your vaccine, you probably have some good protection against it. Like I said, up to 80%. And then there have been lots of studies around this where they're taking samples from patients who have the variant. And we're seeing that after the vaccine is given in vivo, or in vitro, sorry, to these samples, that the antibodies against all of the proteins that the variant is making, the antibodies are present. So they should work. They theoretically should work. And again, some of the data showing maybe up to 80%. It could even be better potentially. We don't know enough about. I think we don't have enough information about Janssen yet. Again, they're all going to offer some protection. This is when sometimes I go back to the flu vaccine, although the flu never caused, 600,000 deaths in a year, or never to that extent. Typically, for people to get sort of a frame of reference, usually in a typical year, we'd have 10 to 60,000 deaths from flu. But one of the reasons that we flu was under better control is that people did get vaccinated, and the vaccine was never perfect. The vaccine was usually somewhere between 50 to 70% effective. So the fact that we have a couple of vaccines that are 95% effective on first blush, and then another one that's about 70% effective, I mean, this is amazing. So even if with the variants, this takes down the effectiveness a little bit more, I think what we know with vaccines in general is that they also potentially help, or you end up having, if you get infected still, disease severity is usually less, disease symptoms are usually less, all of those things. So I'm still not quite alarmed by the Delta, and I know that because we have 3 working vaccines, and I think there'll be more that end up coming up in the next year, more opportunity or more vaccine options, I think we'll get a better handle on this. But variants are going to come up with something that is still sort of allowed to spread in certain areas, somewhat unmitigated. Fortunately, in California, that's not quite what we're dealing with. We probably have some of the highest vaccine acceptance rates in the country, if not the world, which is really great, but we still got to get to some of those last people.
I'd also love to note that in terms of vaccination and things constantly changing, what gives me a lot of hope and confidence in all of these vaccines is actually what we were talking about earlier, kind of when things came up, there were, a few cases of those blood clots, a few cases of myocarditis. People were on it. Like these are, I think, like the most, correct me if I'm wrong, but this is what I've heard, the like most monitored vaccines in history, right? Like we've never had monitoring systems like this before. So things, as soon as things are changing, definitely we can identify them, work to get more information. So, we're learning more every day, and it gives me a lot more confidence personally that there's so much information coming in that people are actually paying a lot of attention to and are taking really seriously.
Jessie, I think that's a really great point. I mean, part of why, so I'm an infectious disease specialist. This is not something I've some of my colleagues have completely embraced COVID. It's sort of their new thing. Part of the reason it's so overwhelming is if you go to look for information, there's so much of it, and there's new stuff coming out all the time. And, sometimes I think it can be a little bit overwhelming. And what do I read, and what's accurate? And of course, I mean, I think this is, related to accuracy, of anything. Find a trusted news source that you like to follow, and usually they're getting data from the same places. And just the immense and intense effort that has gone around this. Certainly, maybe it was a little bit slower at the beginning, and we're not going to say why or how, but things have obviously picked up in the last many months. And yeah, there's so much scrutiny over this. And I don't think there are things that are being held back. The data is being released. Again, when the blood clots happened, it almost happened in a way we don't want to see it, because I think it may have caused, some concern around it. And then it turned out it really wasn't much of anything. I mean, I think it's good for people to be alerted so they could be paying attention to it and aware. But I agree, there's a great wealth of information, which sometimes might be overwhelming for people. So my recommendation from that standpoint is just, use a trusted news source for the data that you want and try to use that.
And Jessie, we had a question about there are some places in San Diego County that have been asking for immigration status before someone gets a vaccine. And when that comes up, where can that be reported to? Is there some place in the health department to report that?
Wow, that's such a great question. I did not know that was happening. That is absolutely not supposed to happen. That's like a thing that we talk about all the time. All the county, like at a county site, that will never happen. That's like very explicitly. That's a great question. I will definitely get back to you on that because that's not something that I've actually heard about before.
I'm wondering if it's happening at like one of these partner sites.
Well, because at this point, like, I don't know, almost anyone can request to host a vaccination site. It's very easy to get that at a work site, which is, definitely great to make things accessible, but also, okay, I could see how that could get sticky. I'll write that.
Yeah, My advice for that would be if it's being hosted by a particular group, like if it were a UCSD event, which I can't imagine that would happen, but let's say it was, you'd want to report to the group that was putting the organization or putting the vaccine clinic on. But then I think there'd have to be a mechanism for that to come back to the county as well.
In the county.
And be able to report that. So it always starts sort of internally, if that were possible, for the group that put it on. And then, yeah, I think it would be good for Jessie to get sort of what would be the best way to report that with, to the county. So that should not be going on.
I definitely,
yeah.
I was just
No, go ahead.
It's definitely important for us to know. And also, yeah, I'm curious why they would possibly ask that. I know that some of like the partners who we work with like a lot of religious and cultural organizations that are doing all sorts of outreach. And I know that they sometimes ask specific demographic questions because they're like, who are we actually helping? Like, are we actually like, I obviously cannot speak for what, exactly what is going on in every organization. But my understanding, because that's not something that they would have to report to the county or any public health department. I'm hoping that it's not, so pernicious and that people are mostly just looking like, oh, are we serving populations who are undocumented? Like I'm curious, but I will definitely find that information and get it out.
So I have two other things, and I don't want to get political, but I want opinions. So, with the Delta variant being something that is spreading across California, we just saw that LA County reinstated their mask mandate. And so, especially for you, Dr. Jill, like talk to us about this.
Yeah.
Should we still be wearing our masks even if we've been vaccinated?
Yeah, this is a tough one, and I specifically just saw that San Diego, at least right now, has continued to uphold the non-mask mandate, even with the Delta variant. That could change, right? That could change sort of it could change in a few weeks. Here's my general feeling. I think if you are someone, this really has to do a little bit with your own, your risk taking, what you are willing to allow for yourself. I'm sure when you go to the pharmacy, the grocery store right now, you'll see that there are people that are still masked, even they don't have to, or even though, there are different reasons for it. I've had conversations with patients who tell me they're never taking their mask off again. I think if you're in a situation where you feel like there are a lot of people and you're not comfortable, I think it's completely appropriate to put your mask on. I mean, for me, nothing has changed that much because in the healthcare system, we still are absolutely required to mask. So I see patients masked when I'm in the hospital. Anywhere I am, I'm still masked. So I haven't been impacted that much, it still feels like nothing has changed. I think if you're going to a place where you don't necessarily know who the people are, and I mean, I feel like a restaurant would be a great example. Should you keep on your mask until you sit at your table? Or should you, if you walk into a store, should you keep your mask on? I think I don't have the answer. I think I'm going to put it back to you at what is your level of risk taking? And if you're someone where that is concerning for you, you maybe have a medical comorbidity that maybe puts you at higher risk. Maybe bring the mask with you and put it on. And then when you're back in the safety of your car or just with a small group of people, take the mask down. I certainly wouldn't go back to, I think there was a period of time where we were doing things that really at no time made scientific sense to me, like out on the street, you're walking by yourself. Why did you need to have your mask on the whole time? I never really got that. But now, I think it's a little bit more reasonable, but there may be times where it is worth masking up for your own personal safety and those in your life. I hope that helps.
That's reasonable. Yeah. So my last question, and I'm gonna have both of you answer this. In the community, there's hesitancy to trust outside of the community, right? And as an ally, I bring allyship everywhere I go. And so, you know, as an ally to people in general, not just the LGBTQ community, how do I talk to those that are still hesitant? How do I talk to parents who are hesitant for their 12 to 17-year-olds? Like, just in general, what kind of tips can you give us to share that we can maybe help to, in particular, that demographic and the LGBTQ community demographic, to bring them more in line with vaccinations?
This is my whole job, so I'm happy, happy to answer this question. Happy to do it. Yeah, I think what's really important is to think about how, like, the reasons why people are hesitant or reluctant to get vaccinated is like, people have so many different reasons, and it's impossible to even think about how many there are. And so I think whatever you're going to do, go into any conversation with people with a very compassionate, patient mindset, where you're there to listen instead of tell them why they should get the vaccine, and vaccine is the right option for them for sure. I think that is very off-putting to a lot of people, and I don't think they're gonna, you know, they've heard it already, right? Like, they've heard it. So I think what would be most useful, at least in my own experience and what I've heard from other people, is compassionately listening to, you know, what people's concerns are, because their concerns are totally valid. Their questions are also so reasonable, and you know, keeping yourself as best informed as you can, and, you know, even if you don't have the answer to their question, right? If they're like, but we don't even know how it's made, you know, you can definitely do your own independent research and be like, yeah, I can help explain it to you. I searched myself, because I think a lot of people, there's uncertainty in questions that, you know, we don't have the answers to all of them, but we do have the answers to a lot of them. And I think just patiently and kindly sitting down with someone and walking through it, not with a specific goal in mind, not like at the end of this, like, we're gonna walk you straight to the vaccination site, but more like, we're gonna hear everyone out, is how it's worked best for me.
Dr. Jill.
Yeah, and I mean, I think that was a great answer. I think, you know, in addition to compassion and listening and all of that, which is extremely important, I do try to find out, you know, so tell me what, you know, what concerns you. And like Jessie said, it can be really different for various people. Sometimes though, it's just as simple as, my friend got it and their arm hurts so much, and I just don't want to do that. So those are really easy things to, you know, that's a very easy thing to approach. Well, yeah, it did hurt your friend's arm. I'm not surprised. We know that happens with vaccines. So sometimes, you know, learning the reason why is really important. You know, sometimes I'll hear, well, I have bad allergies, or in my family, we have bad allergies to things. So I didn't think it was smart. And they're really easy, you know, there's easy pieces of information that we can give to people to say, why that's probably not the case. So if it's an easy, compatible, you know, misinformation to say, oh yeah, you know, I read that too, or I saw that also, but you know, I actually talked to the doctor, or I read this, and here's what I learned. That may help. There are some people, and I've come across in my patient population, a lot of patients who are saying, you know, I just want to wait until more people have done this. We may now be at the point, though, where more people have done it, right? We're 6 months into these vaccines being given. I just said 1 billion. I'm not sure if that's true. Certainly hundreds of millions of people having gotten the vaccine. So if you had people saying, you know, I just want to wait. I want to wait till more people. I've heard that I don't want to be a guinea pig. That makes me kind of laugh, because I say, are millions of people guinea pigs now? Because usually a guinea pig is just like one person. That's just a few people. So I think returning to that, I want to wait. Maybe people are now at well, I feel comfortable. It's been about 6 months. Maybe I do feel comfortable doing this. So I think just trying to figure out what that reason is. I'm looking forward to, I think I'm seeing a patient in a month who very clearly told me this was not something he was going to get and really sort of wanted to drop it. I'm looking forward to seeing him again to see sort of where he is with things. And I think it's always starting with where are you with it? And I think something that we do a lot in medicine now is called motivational interviewing. And it's really letting people guide us with their own strengths. And it's sort of asking where they are and what could push them closer to a place where they would, and what would actually take them away, what would move them up, what might move them down, and sort of just getting that understanding from people, I think, is really helpful. And then I think that then helps them to understand where they are with things too. Maybe helps them get them a little bit closer.
Yeah,
I agree.
Awesome.
And I think maybe the last thing I'd want to say about that also is, I think, I do so much sitting behind my desk being like, how can I make a TikTok that'll make everyone get vaccinated? Or that's my job. Wild, right? Or how do I convince people? And, when I actually am able to go out to vaccination sites and go table, I'm so pleasantly surprised that it really seems like so many people who are not vaccinated yet, it's a convenience thing, right? Especially the people who are my age, who are younger, early 20s, or, any in the under, I think it's under 29 age group. It's a lot about convenience. So if I'm at a vaccination site, near the beach, and I see people walking by and we're giving no appointment Johnson & Johnson, so the one shot vaccines, I'll be like, hey, do you want a vaccine? And people do. I think in that vein, if people are just oh, I don't have time, or oh, that, I'm not going to feel so good the next day, I'll have to take the day off work, or it's an inconvenience to them. Maybe make it fun. You guys could go do something together. The actual, vaccination itself won't take very long. You can go get some ice cream, go get vaccinated, and go dance or something. I think it's accessibility is still a huge part of this, and feeling like I can't go out to get it, or and you can also through my turn, or if you schedule an appointment, you can get a free ride, you can get transportation. So hopefully that is not a barrier anymore. But just saying that yes, definitely, if you feel comfortable, talk to the people in your life who are having concerns, or are not sure they want to do it, but also maybe drive with the people who just feel like they haven't had the time yet.
That's a good point. Yeah, the accessibility piece is definitely there. I think, both of you commented on that piece of some of the folks that I have talked to. It's that I'm going to be sick for days. I can't do that. And that's a much bigger conversation about our culture of overwork and productivity and all of that kind of stuff. And that was one of the things that I did, was I just marked those days off and said, nope, I'm just marking those days off. And I didn't really feel that badly.
Right.
But I just marked those days off because we should be taking care of ourselves in that way. So big believer in that.
And I would say if there's one piece of advice to give someone, if you can, when you're getting the vaccine, try to do it on give yourself 24 hours where you don't have to be at your best. I think we can all sort of slug through things. And again, that's a whole other conversation. But I do like to say, give yourself 24 hours if you can. So I know it's not always possible. Yeah. And anyway, so I just wanted to bring that up. Put the Dr. Hack back on one more time.
Yes.
24 hours is definitely better than folks who I know who a year after getting their first COVID symptoms are still feeling it. So
I know it's the top of the hour. We didn't talk about long haul COVID at all. And that is something that is very real and legitimate. And yes, I take 24 hours of feeling crappy to long-term symptoms, and obviously the other terrible thing, which would be actually a fatality. So anyway.
Yeah. Good point. We're going to end on that. Thank you all so much for jumping in on this call. I super appreciate both of you taking the time. We appreciate all that the county is doing, and all that UCSD has been doing in kind of helping to lead this force forward from early on in the vaccination process. If you have other questions that didn't get answered or want to contact anyone, you can always reach out to info@transfamilysos.org, and we'll be happy to put you in touch. And this will be on our live stream, so you can share it out with other people. This might be a good starting place if you have a loved one that is hesitant that you want to help to kind of maybe push forward. So thanks again, everybody. Have a great evening.
Bye. Thank you.